Hi, thank you for tuning in again to this series of OCD and ERP. I'm Jaime. I'm an ERP therapist and a CBT therapist and an EMDR therapist. So today we're talking about OCD intrusions again. It's not just thoughts, why sensations, emotions, and energies also matter and how they impact. So when I talk about OCD with people, you may notice that sometimes I have mentioned through the videos about, or through the podcast, you can also look and check. Um, I often refer to intrusive thoughts, intrusive images, intrusive urges, intrusive sensations. And yes, it sounds a lot of information, right? And there is a very good reason why these other intrusions, whether they are cognitive or sensory, um, so cognitive means thinking, thoughts, images, and so on, sensory image, sensations, physical sensations. The reason for that is because when you read about OCD, especially around clinical sort of books and articles, the focus is usually on the thoughts, right? And sometimes images get mentioned. Nowadays, a bit more, and rarely we see any explanation about an intrusion actually being more images or thoughts. There is more. This is changing. That's great. Um, so let's put something clear that I come across all the time is the intrusions aren't just mental. They can be physical, they could be emotions of shame, emotion of guilt, they could be sensory. So it could be like tinglings, that could be smells, that could be shivers. Um, and if I'm talking to someone who experienced this, or those who do, you probably know what I'm going on about. So for example, let's think about shame or guilt. Let's think about guilt. You may feel a sudden overwhelming sense of guilt and not really know where it comes from, right? So your brain jumps to, I must have done something wrong. Otherwise, why do I feel guilty, right? Why is this guilt so strong? I've done something wrong. Something I've done, I'm not sure what, to who, when, where. I've done something wrong. And what happens next? Then you do something about it. You do a compulsion. You may apologize to people. You may seek for reassurance. You may be extra good. You may be even pray more if you do pray. You may do whatever it takes to get rid of the guilt, and the guilt being a really strong emotional reaction. So you, like everybody else, like any normal person who feels overwhelming guilt, will try to do something about it, right? What happens is within OCD, sometimes there's that doubt when we feel that guilt, and then we respond to it. We're not sure we've done something. It's a felt sense, and therefore we respond to it. Okay? And then the OCD cycle starts. Okay? So let's share it now with you. What happens is you have that urge, that feels that guilt, and therefore what you do is at some point you feel that guilt, you feel overwhelmed. Then when you notice is you doubt, then you might be thinking of what you've done. Have I done this? Have I done that? And then what you do, or what people do, and I say you, we all do, or some of us do, is that we start feeling other emotions, like a secondary emotion, perhaps anxiety, perhaps fear, and added with the guilt, we do something, we respond, right? So we have responded, And we then can do that by reassurance. We can do mental tracing. We can then do confess to people things. What we are aiming, or one may be aiming, is to the anxiety to reduce, the fear to reduce, the guilt to reduce. And it does. And it does to some extent. What then it happens is that inadvertently, another time, either of those come up again. So we may feel more guilty, we might start having more doubts, and then we start having the secondary emotions, and then we respond again. Okay? So that's what we call the OCD cycle, the vicious cycle that it starts. And if you remember from a few videos before, we spoke about habituation, we spoke about getting used to this here. Guilt is slightly different. We cannot get habituated to guilt. We can reframe that in a different way. Okay, so let me stop sharing. So what you've seen there is that the loop of obsessions, the meaning, the compulsions, and the temporary relief happens, right? So I'm feeling bad, I've done something bad, then, I feel guilty, I think I've done something bad, I interpret my guilt. And that's where we go from the previous video, that interpretation, that meaning, and how we respond. So we interpret our emotion of guilt as I must have done something wrong. The meaning is I'm a bad person, and then we respond to it in some manner. And then the loop starts in the short temporary relief, and that is in place. So the more you're trying to escape this feeling, if you notice from the drawing, there is that guilt happens again, maybe some disgust, some anxiety, and even physical sensations. The more you're feeling it, the worse you're feeling. So if you're feeling guilt, you're going to feel it in your body. If you're feeling anxiety, you feel it in your body. So that makes the intrusions feel even more important or more real because they feel dangerous. They need to go away. Your brain is trying to work out all of this for it to go away and make you feel better. It is the same pattern with intrusive thoughts and images, right? And the more you're trying to suppress them, the stronger they get. The more you try to neutralize them, it makes them to stick more. So the more you try to stop them, block them, don't come back, I don't want to feel this way, they keep coming more. So here is the takeaway from today, right? So here is the sum up of today. I would like to put 3 things again. So emotions can be intrusions, a sensation can be intrusion, and an urge can be intrusion. And if you are watching this video and you experience any of these, you know how they feel. And if anyone who is experiencing those wants to know, you are not doing OCD wrong. If someone experiences these and they don't know what they are or what they mean, that doesn't mean that they are doing their OCD is wrong or they are broken or you are missing something because I don't have these intrusions, right? It means that the OCD is presenting in a different thing. You need to tweak the language you're speaking. You need to change slightly that into next time when I'm having an intrusion, we rather than say, well, I'm having an intrusive thought, because we may not have an intrusive thought first, we might swap that for our own experience, which is I'm having an intrusive feeling. I'm having an intrusive sensation. I'm having an intrusive emotion. So if I'm feeling guilty, I'm having an intrusive emotion of guilt. I'm having an intrusive emotion of shame. And with the hope that suddenly that change. And also the treatment principles or the ERP principles start to make more sense to you. Yeah? Because then you can explain, you can apply ERP to those experiences too by helping and supporting your emotions, sensations, and energies exactly the way they need to be supported, treated, like thoughts. There's something that pops automatically unwanted. Okay, so I hope you, with that takeaway, it helps, and I hope you enjoyed. Any questions, give us a comment, like us, share us, and I hope you enjoy. Thank you.